Greetings again, my very dear friend, your friend, Professor Eddy, a professor of public health medicine and the lead for Community Positive Health Attitude Initiative. Today, we are continuing our talk on diabetes, and the aspect of diabetes we are going to talk on today is on how you prevent diabetes, how you treat, little talk on how you treat, because treatment really should be reserved for the physicians. It's not something you can do on your own if you're not a medical doctor. Lastly, we tell you about hypoglycemia. This is a very bad complication of diabetes that usually comes even during treatment. And then we'll give you a little information on how you can monitor your sugar. Let's quickly talk on prevention. Prevention is basic, Classically, type 1 diabetes, which is juvenile onset. Remember initially, if you watch the other videos, we told you that this type of diabetes is the one that you really can't do anything about getting. Usually arises as a result of non-modifiable risk factor. When we talk of prevention, we are going more towards type 2 diabetes. In public health, we usually talk about primary, secondary, and tertiary levels of prevention. Classically, in primary level of prevention, we try, to prevent you from getting the disease at all. And these are the things we've already said when we're talking about risk factors. The World Health Organization and Food and Agricultural Organization, they've gone to specify how, you should eat and the things you should take. You get all these things in our blog section of our website, Again, outside diets, we talked about physical activity. Again, there's recommendation for both old and young child, how the level of exercises and the type of exercise. Again, all these things are in our website. And government can do a lot, can play a lot of role in this primary level of prevention. Government can do this by having policy that discourage people from engaging in those, unhealthy lifestyle. They can increase taxes on alcohol. By the way, again, alcohol consumption and tobacco, they are all things that you must do. They are a primary level of prevention. Outside the unhealthy diet, alcohol, physical activity, then alcohol and tobacco. These are the four you must watch out for in diabetes. But we're saying that government usually, in good society, government has a role to play in that primary level of prevention. They increase the tax. They can do this by increasing taxes on those items that predispose you to getting diabetes. And government also, as by way of primary prevention, in advanced countries, government encourage physical activity. They create walkways. They create cycle routes so that they encourage people to use bicycles. These ones encourage physical activity. So people might just decide to take a walk and move around. It's so nice. But you'll find out in some, developing countries, low and middle income countries, if you do that, walking is a big risk. You've had cases of cars knocking people down because there are no proper walkways created. But in those other places, you have even cycle routes. Cars can be running, trucks can be going, and government has created a situation where people can use cycle and exercise. We advocate that government in the other countries should try and do this. It's beneficial. Again, there are workplace things you can do. These ones are good for the employers of labor, to help people primarily prevent diabetes, such as encouraging them. You can put, like signage, like all these hotels or so many big places you have lifts, You can put signages on the staircase that encourages people to let them know that if they use staircase once in a while, they're exercising. They can take like 3, 4, 5, fleets of staircase, and then they can take a lift. So employers, if people are aware, they can start doing this. And then even in restaurants, in workplaces, the employers can honestly put some signages. Once you're coming to eat, they will let you read something boldly that will let you know that you watch what you eat. So those are primary prevention. So when you get to secondary level of prevention, the whole idea of secondary level, like we keep saying, is to pick the disease early and then commence treatment. That way you go away from complications. We will talk complications in the next episode. And you see, there are so many bad complications associated with diabetes. So you do that in secondary prevention. And you do that essentially by screening and doing tests, like when we talked about diagnosis. Routinely, nothing stops you from checking. I think at least once in 6 months, people should do routine check. These things are not expensive. And so many of these tests are not invasive. As they just say, needle prick, take your blood. You check your urine. So it's creating that consciousness and checking. Because at times, before you know it, the first sign you get is very bad complication that might even kill the person. Then lastly, we talk about the tertiary level. This tertiary level is meant to limit your disability associated with the problem and rehabilitate the patient that has diabetes. For instance, so many of the complications can be, some end up getting amputated, they lose their limb. So tertiary prevention, you don't give up, you keep trying to make the person live on. That's the whole idea about preventive medicine. So you get prosthesis. You get prosthesis for people who have lost their limb and try and help them stay. There are some that will lose their sight. Then you try and see how you can take them through braille or something. But don't give up on anybody so long as the person is alive. So that is the idea of the tertiary prevention. Once you've done these preventive methods, the next thing we are going to talk about is treatment of diabetes. But my dear friends, take note. Don't ever, like you go and do this test on your own, like I advise you do routine tests, and you see you're diabetic, don't start taking drugs. That my neighbor was using this kind of drug, that is what I will use and I'll be okay. You go for the drug. No. There are some drugs you take and you have what we call, we're going to tell you something about hypoglycemia. When the sugar level is so low, problem, it has killed so many people. So don't treat diabetes on your own. There are classes of treatment. And you find out that the insulin-dependent diabetes, that's the one we said is juvenile onset. That is the one that usually the doctors will use is insulin. Leave it to them to prescribe the dose and how you monitor it. But then, if you have type 2 that is so severe, that is having like diabetic ketoacidosis and all those complications, they use insulin too to normalize before they go to the other area. But basically, you can manage diabetes by exercises, diet. You exercise well and you take diet, your lifestyles, and you're okay. Then drugs comes last. That is in the hierarchy of treating diabetes. So basically, the doctors know that basically you have drugs like the classes they call sulfonylureas and biguanide. They are the major ones. There are other smaller types. In fact, these days, research is going on. There are some surgery. I'll say it's bariatric surgery. They try to reduce the size. These are all stuff for the doctors of the stomach and all that. Some do, pancreatic transplant and all that in advanced countries. So, but treatment essentially, once you have it, leave it for the doctor. That is my way of treating diabetes. But like I said, let's give you a few tips about hypoglycemia. Hypoglycemia is when the blood level really has gone so low. Remember, diabetes can also be said to be hyperglycemia. Too much sugar in the blood. But when you have too little, is a problem. There's what they call classically, diabetic coma is two. You say hyperglycemic coma when the sugar is so high, and hypoglycemic coma, which is more dangerous because the sugar level is so low, and once you reduce the sugar content that is going to the brain, big problem. So in this hypoglycemic, so when you do the test, you find out that the blood level, the result of blood sugar test is 3.9 or lower. 3.9 millimoles, which is a 70 milligram percent. It presents with so many symptoms, Classical symptoms can be sweating, dizziness, headache, tremor. The person is so confused. You can start having rapid and fast breathing and heartbeats. The person can start getting very hungry. You see the person craving for food. These are minor symptoms, But when the thing progresses and you do nothing, you have severe symptoms like the person can start getting confused, or they can start getting uncoordinated. You gets up and wants to walk is staggering. The person can have seizure, so many things. And the person can end up again having coma. If you don't do anything fast, the person can die. That is hypoglycemia. It can be as a result of the drug you took. And you find out that people who are on diabetic drug, if you're exercising, we advocate first, but you must be careful. Usually we advise you don't take anti-diabetic medication. We call it, hypoglycemic agents in empty stomach without eating. So these are the problems you can have. And once you reduce this blood sugar level so much, even the person can have permanent brain damage, and the person turns to be a vegetable for life. And these are hazards of treatment. If you're not in the hands of somebody who is properly trained to manage you take overdose of those medications. Hypoglycemia, a big problem. So let's quickly talk about the ways you can monitor your blood sugar. Like you've said, this monitoring really depends. The frequency and the pattern depends on the type of diabetes you have. For people who have type 1 diabetes, like we keep saying, they need more frequent monitoring. You need to pay more attention to them, you need to. But people who have type 2 and they're fairly controlled, the monitoring can be more standard. And the things you use to monitor, you use glucose meter. That's the instrument you use, You use it, it tells you the blood sugar level you have. But please, for people who have this glucose meter, it's advised that once in a while you cross-check, how effective, how efficient it is, how reliable the instrument is. You do this by taking it to the health facility where you receive care, and then using it to check your blood sugar and using the health facility own. If you have a difference of like 15% between the two readings, then either your own is faulty or the health facility own is faulty, and it needs to be investigated. Because so many people use these things and they keep giving false reading. It depends. These things are gadgets. So you need to watch and make sure that the thing you're using to monitor is giving you the right results, So once you monitor, like I said, if it is people who are taking insulin, the frequency of monitoring, at times you can take insulin injection 3 times a day, and you need to know the level before, you take it, So outside this glucose meter monitoring, there's what they call, this one you have it in a more advanced country, is a bit more expensive, continuous glucose monitoring. This one uses a sensor. They put a sensor under the patient's skin, and every 5 to 15 minutes, you have a reading delivered to, electronic gadget like smartphone. So that way, and this one is so beautiful for type 1 diabetes. That way you're in constant touch with your blood sugar level. But it's advised that at least every 2 weeks, every 2 weeks, you change the site of the implant, of the sensor. The other way we use to monitor blood glucose is, we mentioned it when we were talking about diagnosis, is glycosylated hemoglobin estimation. Some call it glycated hemoglobin estimation. It's advised that you do it at least twice a year. The beauty of that one is that it gives you the picture of your blood sugar for the past 3 months, 2 to 3 months. It's good. But again, urine is a very simple test that is good. I remember in the olden days before the advent of all these ones, people who are on insulin, they were even monitoring them with a urine. They put them on what they call sliding scale and check. Urine you dip is a dipstick. You put the stick impregnated with some chemicals in the urine, cross-match the color with some certain color code you already have, is no longer in vogue, but I won't be surprised. Some primary healthcare facilities in some remote places in the world still use it. The other very important thing of doing the urine test is to detect if there are ketones. And like I said, ketones in urine, it even tells you that your blood sugar might be usually occurs when it's up to 250 to 300 milligrams per cent. So it's bad. And if you allow it go further and have diabetic ketoacidosis, it's a complication that is life-threatening. So those are the things, how you monitor your diabetes. But like I said, please make sure you're under the care. In fact, so many of these big hospitals have diabetic associations where you peer review your activities with the other patients too. It helps. So our message, as usual, my dear friends, please stay alive. Work so hard to stay alive. Honestly. What you eat, watch it. Exercises, try and do. Your medication, try and make sure you're guided by a doctor. You know, like I said, diabetes is no problem. WHO said it. Like we keep telling you in their key messages they published on 16th of September 2022, they said that diabetes can be treated and then its consequences prevented or delayed by eating physical activity. And then you take medications and then you try and work towards avoiding the complications. And we keep telling you we love you. That's where we're stressing and doing this. Honestly, there are so many people are perishing because of lack of knowledge and ignorance. Please, let people know that this diabetes can be avoided. If you have it, can be prevented, so that you stay alive. Your friends, your relatives, they love you. Once you die or you have complications of diabetes and they cut off your leg or your arm, you create problems for people around. So why don't you do the little needful so that you can stay alive? As we usually see people say, no, it's not my portion. I reject it. You reject what? It's not within you to reject. So do the needful, because these things can happen to anybody. Even doctors, professors. The only thing you can do is that you watch those modifiable risk factors, improve on your lifestyle and stay alive. We love you so much. Like I said, the details of what we're saying, you can get in our website, www.cophai.com. www.cophai.com. It stands for Community Positive Health Attitude Initiative. So stay alive, my dear friends. We love you. See you in the next episode, which is on complications and myths. Thank you.